I think that if I could just speak to women in general, and this is I'm not the nicest person. I know that. When I'm in the office, sometimes I get complaints. People don't know. They say I'm a little strong or assertive, or I'm in their face, and I definitely.
But she's getting curious about that.
Yeah, I'm trying. Maybe I don't have the ability to modulate my tone like my husband says, but I do have something I want to say to women, and that's this. The reason for the uncomfortable feeling in your pelvis is that you are inadvertently sucking in your gut so tightly, crushing your soft tissues in the grip of your own vagina clench, and unnaturally over-contracting the bottom muscles of your body, especially your lower abdomen and pelvic floor, but also your lower back. Without awareness, you routinely posture yourself in a chronic Kegel, walking around all day holding in your pee and poop because at some level you think if you let go for a split second, you will pee or poop on the floor. Persistent butt clenching poses are silencing your bowels so that you may experience periods of constipation alternating with spastic colon or bloating and gas. You are oblivious to these movements, which are cutting off the circulation to your bottom, causing a depletion of oxygen, which at the cellular level produces a buildup of lactic acid in your lower muscles as the cells convert to anaerobic respiration. The toxic environment may feel like a throbbing or stabbing sensation in your lower abdomen, urethra, or vagina, whether or not you know it, and for a variety of many possible reasons, which most likely include early childhood trauma and your overwhelming life. You are stressed out. Because you have incompletely built the nerve connections from your top to your bottom, you don't process sensations from that region properly. And also, despite how healthy you try to be, you are unknowingly causing yourself physical harm by suffocating the urothelial lining of your urethra until it bleeds and sloughs off epithelial cells. You hold on to everything and let nothing through because you don't have discretion in what should remain or go. You also let nothing inside without tremendous resistance because it's hard to know what is safe and trustworthy. Because of the disconnection, the pathway is circuitous and feeds back on itself to catastrophize many situations, leading to hypochondria. Does anybody relate to this? No? Nobody relates to this? It's like this. The more you worry there's something wrong with your body, the more you clamp your vagina tightly all day long and barely let go when you pee or poop, causing the need to push, backing up your system, and creating blood in your urine, kidney stones, and lower abdominal discomfort. Then, the increased pressure caused by the tighter clench causes more worry. There is something wrong until something wrong actually happens. This is what I would say to every woman who comes in to see me, so that they can understand how these processes work in their body. You're on the toilet, you have to lean forward with a straight back, okay? Your elbows need to be close to your knees, okay? You have to have an angle here. And listen, back in the days of the cavemen, well, we weren't living that long, but now we have to know, we have to be smarter. Okay, we have to understand our anatomy better. We have to understand everything so that we can live to 100 without peeing all over ourselves. All right, so you just lean forward and you have to let your belly go and your backside. Okay, you have to have enough awareness to be able to do these postural maneuvers.
Like relax.
Relax and let your belly go. Come. Lean forward. Everybody in this room has been toilet trained by me, and if you haven't, take a number. I'll do it. Okay. All right. Let your belly drop. Let your belly drop. Okay. Put your finger under your nose like a mustache and smell. But don't just do a. Yes, that's how you pee.
Ooh.
Do you feel it open? Yeah. Okay. The second mouth. What does that mean? All right. Okay. Women are two-mouthed creatures. We were born that way. All right. We got a mouth on the top, and it's just like the mouth on the bottom, anatomically, structurally, and even neurologically, which means there's a connection between these two mouths, the jaw and the backbone, the tailbone. Okay. When we are peeing, we have to open this jaw. We have to drop this muscle down. It's so stupid. It's the dumbest thing I could ever start talking about. But there's a little muscle on the bottom of the vagina that has to literally pull back so that we can urinate, okay? It's not the only way you urinate. You can push, and it works until it doesn't, or until you start distorting yourself and making yourself incontinent. But if you understand the concept of opening this muscle like a second mouth, you pee without damaging yourself. and without causing trauma to your internal systems. This is much more than about urinating and defecating. This is about emotional regulation. This is about regulating your nervous system. This is about not causing yourself, what do you treat? Diverticulitis?
Oh, yeah.
Is that the one where they blow pockets into their colon? You have to look at this from my perspective. I mean, I'm a scientist. I'm like, oh God, she blew out her colon again. I mean, this is how I talk about people. She blew out her colon again? Do you think that woman knew she blew out her colon? Why doesn't she know? Because it's not conscious to her. And no one's telling her this.
And more than once.
Well, maybe except men.
Kim, how loud is your voice? Are you loud enough to treat the 4 billion women on the planet that are blowing out their colon? This is basic childhood vital processes. Do you have anything to say about this? I'm putting you on the panel, Melissa. What do you see in your practice?
You know, what you're describing, but then it can get to the point that it becomes a dysfunction. And dysfunction can also equal pain. And so that's something that I also see very often, that there's so much change within the tissue and within the muscle that people have pain. It's painful to pee. It's painful to put anything on the inside. You know, it could be younger women who can't put in a tampon anymore. Never mind putting in a vibrator or fingers or a penis. So, you know, you want it to be at the point where everything it's connected. The breath is connected to the pelvis, and that's what your abdominal wall is helping to do. And what Dr. Fleischmann is stating is everything where you're utilizing the breath to be able to control from below. And, you know, what we do as pelvic floor therapists is we have the training and the ability to do internal work. And how I describe it is that these are muscles like other muscles in the body. They're just in a private place. And there's no reason why you can't, you know, regain the control over them. Yes, there are times when organs are falling out. When someone's had 14 children and their uterus or their bladder is laying on the table, you know, I can't push that in anymore. And that's a surgical fix. Or someone who has, you know, a rectal prolapse. Your anus is not supposed to be inside out. That is something that has to be surgically fixed. You know, but these are the kind of things where this is a way that you can retrain your body, and it's something that you do multiple times during the day, you know. And I tell people all the time, you never push to get it started, you never push to get the last little bit out. Yes, you'll pee, but then ultimately, you're going to be seeing Dr. Fleischmann. She's going to do a post-void residual that's going to show on an ultrasound that you just went to the toilet and now you're back on the table and you still have 200 cc's of pee in you.
So
not
what
supposed
do you
to be
do
any
about
left
that? Can
over.
you both talk about that?
Yeah, I
What do
don't
you do about that last bit that you feel like you have to push out?
You can push as hard as you want if you keep your nasal passages open. And neurologically, that's very difficult for people to understand. So I talk a lot about neurological milestones, and this is one that I consider to be the granddaddy, okay? So neurological milestones are how you learn to stop all the reflexive movements of your body and make them more purposeful, okay? When it comes to the pelvic floor, learning that kind of control is the hardest for us, and there's a lot of reasons. It's the last muscle of the body that we're learning to control, okay? And no one's talking to us about it. We don't touch it, hopefully. Hopefully no one's touching it when you're a child. If they do touch it, there's other problems that develop, okay? And I don't want to even speak about those here. But this part of the area is the last part of the body that developmentally our brain is able to contact. It's the very lowest one, okay? So for us to learn to contact this, we need guidance, okay? And that guidance can come from a caregiver, like a mother, or it can come from a good friend, but someone has to teach us how to connect to it, okay? This is a neurological connection, and it comes when your sniff hits your bottom. When you feel your sniff hit your bottom, that's a brain connection, where suddenly your brain sees the boundaries of your body, okay? It knows that your bottom's there, knows your front's there, knows your back's there, okay? We're seeing the inside of our system through a very old primitive sense called our sniff. And that's how we develop core awareness. And once we have core awareness, urine can leave our bodies safely, and so can poop. and we can have sex comfortably regardless of whether we have estrogen in our bodies. Listen, all the things that we're doing here, I love. I love all the help that we can get. But the brain-body connection is essential. And whether these modalities help us make the brain-body connection, I mean, if they're good, anything that helps, I love it, okay? I gave you all a nasal inhaler. I think using this, and just understand, does everybody have one? There's so much for my patients. We all talk. If you want to have an orgasm, you cannot clench your teeth. You have to relax your jaw. And jaw relaxation is not the same as opening your jaw. And this is why the second mouth is so hard for us to envision. This is why we don't have the correct body image, okay? When someone says to you, how do you relax your jaw? Just show me.
Lips together, teeth apart.
Okay. How do you relax your jaw?
Oh, put the tongue, tip of my tongue at the top of my palate behind my teeth, and then let what she said.
Okay, now open your jaw. That's different. We have 3 levels, okay? We have closed, we have relaxed, and we have open. And so does our vagina, okay? The problem is we only know the teeth clench or the jaw relaxed. That's all we know. We don't learn the third gear. That's the one that has to happen. To pee, poop, have sex, have a child. We need to understand the bottom gear.
To birth the child.
To birth the child so we don't damage ourselves.
We have glottis and all
yes,
that.
yes. There's 3 gears down here and we only know 2. Children learn 2. We need to know there's a third. Is that a simple way to explain it? I don't know.
Yeah.
Good.
You get it.
Relax your jaw.
Okay.
And if you can take a sniff, that's even better. And we have not enough PTs, and we certainly don't have enough of me, because I'm a unicorn, folks. I don't know. I trained 11 years after medical school to become a female pelvic floor reconstructive surgeon. So you're not going to find a lot of me. I'm toilet training all day. I'm on a massive mission. Toilet train women. Ask my girls. I mean, it's all I do all day, and I'm one person.
And the first female in Westchester.
I need help. I'm asking for some help here, okay? I can't do it. And I can't stand the suffering. So
We are here to help you. So we are actually, one of the things that we're doing is training. Nicole? Where's Nicole?
Come here, Nicole. We're training our beautiful nurse practitioner with Dr. Fleischmann to be her ambassador.
Oh, that's
and to help her so we can do individual and group classes on how to actually do what she's teaching you, but how to maintain it.
it's not easy, folks. This is not an easy brain connection to make, okay? And I have a lot of people in the room that can attest to this, because for people who don't know what I'm talking about, this sometimes takes weeks to months for people to understand, okay? Learning how to release your pelvic floor to urinate and defecate properly and to breathe and to have sex. Folks, this is about sex too. You know, you can't have an orgasm if you are clenching your butt so tightly. And these things are not conscious to us. They're all happening under the radar, and we're all doing them all day long. And no one's telling us to stop, no one who cares about us. But I want us all to care about each other. To say, stop butt clenching, stop vagina clenching. You don't need to do that. You needed to do that when you're 3, not when you're 40. Okay? Your body holds things for you, right? Your body releases things for you. All you have to do is get out of its way. Stop being dysfunctional. Stop ending up in my office because you're dysfunctional, because you didn't learn something you were supposed to learn when you were 3. That's why I have to be compassionate.
We didn't know.
You didn't know. I know.
You don't know. You don't know.
You didn't know. It's not your fault.
But now you know.
Once you know, you know.
Now you know.
I
still don't know what
This is.
Okay. Does anyone not know what I'm talking about? If you don't, please, and I really want you to say, okay, when you're on the toilet, you have to sniff out your pee. And it's not an easy thing to do.